Hello YouTube, my name is Chaz and this is my first ever uploaded video to YouTube or to the internet for that matter. This was actually my eldest son's idea and he's been wanting to post videos and upload videos to YouTube for probably about a year now. And I was a little reluctant to it to open up our lives to everybody, but decided that it would be a fantastic idea to share our story with you guys. He wanted to do informative videos as well as in the life of videos and do it as a mother and son duo. So we'll be posting videos for you guys to follow along with us, and hopefully you guys will find it a little interesting. Just to give you a little bit of a background on us, Mikey is 11 years old. He is currently a 6th grader. He's not the average 6th grader, and we're not the average family either. Mikey, we consider our super strong undercover superhero. And just to give you a background and a reason why we think of him as our undercover superhero is because Mikey has gone through a lot since the day, I shouldn't even say the day he was born, even before he was born. While he was in my stomach, he's just been a fighter, and he had to be. I had a very difficult pregnancy. I was 21 years old when I was pregnant with him, and I did not know whether the feelings that I was feeling was abnormal or even normal for that matter. Around 12 weeks, I was expressing these feelings to the doctor and just felt like I was open in my womanly area, and I was having Braxton Hicks. I was having contractions, and the doctor had told me it was probably just Braxton Hicks, not to be worried, that I was 21 years old, that I was healthy, that it was all in my head, and just kind of brushed me off. So even though deep in my heart I felt like something was wrong. At 19 weeks, while I was at work, I received a call from a perinatologist informing me that my AFP test had come back abnormal and that it looked like the baby had Down syndrome. My brother had Downs, so I thought, well, okay, it could possibly be that my baby also has Downs. I was scheduled for an appointment the next day and to do an ultrasound on the baby's anatomy, and the doctor told me the baby looked healthy. Baby didn't look like he had Downs. I was having a boy, however, I was 6 centimeters dilated, and my baby's foot was in the canal. I had an emergency cerclage placed on my cervix, which means that they put sutures on my cervix to close my cervix. What I was diagnosed with was having an incompetent cervix, which means that the more weight the baby puts on during the pregnancy, which normally happens at around 12 weeks, my cervix weakens and it just gradually begins to dilate to open on its own. And I was placed on complete hospital bed rest. I laid in the bed in a Trendelenburg position, which meant that my feet were elevated higher than my head. Here's my feet, here's my head, and this is how I laid. It prevented pressure, it took the pressure off my cervix. I was on magnesium sulfate along with many other medications to help my muscles relax so that I would not contract any longer, preventing me from dilating me any further. And I had a catheter on. I was allowed 1 shower a week. Whoa. We all know that 1 shower a week is just not enough, but I needed to do that to gain more time for the baby so that he could grow. And I was told during my hospitalization that every 1 day that the baby is in utero, that is 3 days out of the NICU for the baby. And I was motivated to keep my baby out of the NICU, to make sure that he was healthy. I went into labor at 27 weeks, so from 19 weeks to 27 weeks, I was on this bed rest. I went into labor and I was given more steroids. I was given more medication to stop the contractions. My body had given out. Mikey was ready to enter this world, and I was in labor for 26 hours before I had him. The nurses, the doctors tried to prepare me during the whole time of me being in labor of what to expect, but nothing could have prepared me for what was going on. I'm sorry, I'm getting emotional again. Mikey came at 27 2/7. He weighed 2 pounds, 6.7 ounces. And right after delivery, in my head, I was expecting to hear a cry. I had never seen what a 2-pound baby looked like. To see a 2-pounder, to see your child come out of you and not breathing, very tiny, very limp. His coloring was blue. Seeing the nurses, the NICU nurses, rushing to resuscitate him, rushing to intubate him, I was terrified. I was petrified. I was crying so hard inside of myself that I did not know what was going to happen, what the outcome of this would be. The nurses strolled me over to my room in the gurney, and a nurse stayed and had told me that my baby was very ill, that he had hydrocephalus, which is water in the brain. He had a brain hemorrhage, a PDA, a hole in the heart. He had an infection. He had many things that were going on because of his prematurity, and because of it, he may never be able to sit, he may never be able to stand, walk, talk, possibly eat, that he could be blind, deaf, just a whole list of things that could possibly be wrong because of his early delivery and because he was so sick. I stayed in the room and I cried. And I cried, and I cried, and I cried, and I cried for hours. Hearing that he may not survive the night, he may not survive, if he survived that night, he was going to have lots of ups and downs, and trying to prepare myself for that, and being in that room without holding my baby, you have a lot of time to think and a lot of time to wonder why and what if I did this, what if I did that, well, what did I do wrong? I went through that for a long time, and I finally got to see Mikey a few hours after his birth. They strolled me in on my bed into the NICU where he was, and I got to see him. He was 15 inches long, and again, 2 pounds, 6 ounces, very tiny. He had breathing tubes all over him. He had IVs all over him. He dropped to, the lowest weight he had dropped down to was 1 pound, 12 ounces, and he was so tiny. He had a few blood transfusions. Full 2 months he stayed in the hospital. Right before he was released from the hospital, the doctors told us that he had cerebral palsy, but to what extent we did not know at that time. We've seen lots of doctors and lots of specialists that I can't even think of at the top of my head right now. He started therapy, occupational therapy, and physical therapy. We had nurses coming out to the house regularly, therapists coming out to our house regularly as early preventives. And from that point to now, I can honestly say he's probably had thousands of physical therapy sessions. Mikey is diagnosed with spastic diplegia cerebral palsy, which affects the lower portion of his legs, causing them to be very spastic, meaning very tight. His muscles in his lower region contract and have inevitably gotten worse over the years. Even with Mikey's spasticity that he's had throughout the years, he has learned to adapt to the spasticity. When he was around the age of 2, he started to use a walker to get around, and around the age of 5, he started using Canadian crutches or elbow crutches. And within the past year and a half, he has learned how to take about 20 to 30 steps independently without his walker or his crutches. He's not able to stop independently. He will have to grasp onto something to stop and turn around to continue to walk, or sometimes he'll just plop himself on the ground. Mikey's legs, because they have gotten more spastic throughout the years, he's walking more on tippy toes, and his legs are more scissored, meaning that his elbows are almost touching each other when he's walking. Because he is followed very closely by his doctors, his doctor noticed that he was getting more spastic, and that if we did not do anything, he would probably end up in a wheelchair within the next couple of years. We were informed about a baclofen pump, which we've heard about throughout the years, but just personally for us, we were not interested in a baclofen pump. He also mentioned that Mikey looks like he would be a good candidate to have a rhizotomy, a selective dorsal rhizotomy procedure. He spoke to Mikey about what was going on, that his legs were getting tighter, and he was also interested in the selective dorsal rhizotomy. So we did research. We did a lot of research, and this is why we're here today, and this is what has actually started us wanting to go onto YouTube and share this with you guys. There was a lot of literature online about the selective dorsal rhizotomy, or SDR, a few postings on YouTube about it, and the people that had posted on YouTube would show before and after pictures of it, and videos on that, which was very helpful in helping us decide whether or not we wanted to go through with that procedure. And because we are such a huggy-dovey, lovey, touchy-feeling family, thank you, Mikey, family, we wanted to show you the befores, the afters, and the in-betweens of the procedure, and just have you walk through it with us. Maybe this might help you, or if you're thinking about doing this, just additional information out there for you guys. The background here, I have the dividing curtain behind me right now. Mikey's been in the hospital for the past 7 weeks now. We went through with the procedure, and we're very happy with the results. A lot of things he was not able to do before. We were not able to get his legs ever straight because he was so spastic. His heel cords were, like I said, he was on his tippy toes. Now he's almost flat-footed. Calf muscles he's never been able to use. So during this whole process, it's been amazing to see the progress that he has made because of this procedure. And we wanted to share that with you. And we have been taking video anticipating that we would be posting this video for you guys. We've been taking videos of his rehab, before the surgery, after the surgery, and we are supposed to be released tomorrow, and we will continue to get additional therapy for acute therapy for the next year. And Mikey is not able to walk with his sticks yet, or his own walker yet. He still has a lot of different sensations in his legs and feet, but it has been great to see the progress that he has made in the 7 weeks, and just seeing the difference in this, that there's no longer any spasticity in his legs that he's had for the past 11 years of his life. It's a whole new chapter in our book, and we would love for you to follow us and to see the befores and the afters, and the in-betweens. So thank you. I will be posting additional videos, and Mikey will be getting on here as well, and we will love to see you guys. So thank you for joining.